possibly, the most overwhelming stage of life could be immediately following having a baby. The media tells us it's a blissful time with overwhelming waves of love for your tiny human. And this may be true, but the less talked about and more common experience of complete overwhelm, exhaustion, painful nipples, bleeding, breast engorgement, and all these other foreign bodily functions can be ridiculously difficult to deal with, no matter how much support we have at home. Guess what? You're not alone. And guess what else? There's stuff we can do to help. In this video, we're going to chat about the expected and not so wonderful and maybe a little bit gross moments of being a new mom, plus how to properly recover from birth to be the best possible you during this eventful time. I'm Dr. Tiffany and I am a naturopathic doctor in the GTA and a member of the Vitamart educational team. In my practice, I see a lot of women. I see that one of the most emotionally charged times of a woman's life is around having a baby. There's so much focus on fertility and pregnancy. Actually getting pregnant can be a big hurdle for a lot of women. But this is just the prologue. And when that baby comes, many women feel underprepared for what's going on with their body and their baby. Over the next few minutes, I'm going to review what is normal to expect post-birth, the trauma surrounding the process, and key nutritional and supplementation tips for birth recovery. I'm also going to review the common concerns related to breastfeeding and some solutions for these. Okay, let's dig in. All right, so first things first. Let's talk about all the things people don't talk about. What's normal for your body to do and feel like after you give birth? Constipation. Yes, you probably struggled with this throughout your pregnancy. Sorry ladies, but giving birth doesn't necessarily resolve this problem. You've had trauma to your abdominal muscles and possibly even surgery. So if this is the case for you, continue with your magnesium citrate and high-dose vitamin C. Warm water with lemon, and all those great dietary fibers to help relieve the discomfort associated with your constipation. Next, you should know it is common to sweat and urinate excessively following birth. Your body is purging. This doesn't mean anything is wrong, and no, this is not permanent, but make sure that in those first weeks after birth, you're replenishing your electrolytes and stay hydrated to offset the water loss. The next thing I want to normalize is bleeding post-birth. Think about the huge transformation your uterus has gone through over the past 10 months. And all of a sudden, it doesn't need to be so big and cushy anymore. That uterus takes time to shrink back to normal size and heal the site where the placenta was sitting. This process involves some muscle contraction, so there can be some pain with this, similar to period cramps. This can be quite painful for some women, and may be worse during breastfeeding because of the hormonal shifts that occur. This shrinking of the uterus can also cause some bleeding. It's normal for this bleeding to last up to 4 to 6 weeks post-birth. The thing that is important for you to be aware of here is that sometimes bleeding can also be concerning. If bleeding is excessive, it can indicate underlying issues that must be resolved by your doctor. So how much bleeding is okay and how much bleeding is too much? After birth, you will use peri-pads. For the first 2 days, the bleeding should be bright red blood, and if you're filling your peri-pad every hour, this is too much. By day 2, the blood should be changing to a darker red and should now be much lighter. You're looking for a stain on the peri-pad less than 10 to 15 centimeters. By day 3 to 4, the blood should be more of a pink color. And by day 10, the discharge should be almost a yellow-white color. This is what you might experience until 4 to 6 weeks after your baby is born. If you're experiencing anything beyond this, chat with your doctor. If you gave birth vaginally, you will likely have quite a bit of swelling and possibly some bruising. You can try ice packs throughout the first 24 hours to prevent excess swelling, but be sure to avoid this after that 24-hour mark. We actually want all the fluid to start to drain, and keeping the ice on it can prevent that. If you experience injury to the perineum, which is the patch of skin between the vaginal area and the rectum, you can try doing a sitz bath a couple of times a day to help with healing. You can also try homeopathic arnica a couple of times a day for the first few days to help with healing. Don't use the arnica creams, go for the little pellets. Boiron has homeopathic arnica in a little tube with more than enough pellets for what you'll need. You can put 2 to 3 of these pellets under your tongue and let them dissolve. They're safe because they won't interact with anything else you might be taking. They're reasonably priced and they taste great because they're made of sugar. For additional soothing, and if you're also struggling with hemorrhoids, you can use witch hazel tincture by NFH on a little makeup pad, and that can be very relieving for itching and swelling. Breast engorgement is another discomfort you will likely encounter. Make sure you have a well-fitting, supportive bra, and it can be worn at night too. You can try applying a warm compress to the breasts. Try gentle breast massage, and a very naturopathic trick for you, crunch up some cabbage leaves and use them as a topical compress in your bra. Okay, so enough about that stuff. Let's get mushy here for a minute. If no one has expressed this to you yet, you should know that the birth process can be very traumatic for a lot of women. And as with any trauma, it's normal to have lasting feelings about that trauma for a long time after the birth. It's also very common to experience things like postpartum anxiety and postpartum depression in the weeks following birth. 75 to 80% of women experience postpartum blues, and this can present with tearfulness, low spirit, anxiety, forgetfulness, tiredness, and emotional swings. And 10 to 15% of women are diagnosed with postpartum depression. It doesn't mean you're any less of a mom or any less of a person. It's a common hormonally driven reaction to this process, made worse by sleep deprivation. To minimize the trauma associated with your birth, I recommend to all my patients to make a thorough birth plan. The more information included in that plan, the better. Map out a plan A, B, and C with all the little what ifs answered. That way, when the unexpected arises during labor, and inevitably something will, you're already prepared with your wishes and plans. It allows you to maintain some level of control throughout the process. Also, do not be hesitant to reach out for help. Whether it's your doula, your naturopath, your family doctor, your therapist, or a great friend, it's okay to reach out and ask for help. There is so much focus on baby post-birth, so make sure you have some people in your health team that are solely responsible for mom and her well-being. Just because the postpartum blues and postpartum depression and anxiety are common does not mean you can't get help and shouldn't feel better. Now let's talk nutrition. Your body has undergone a lot. First, a 10-month pregnancy, and then an eventful birth. What can you do to help your body recover and continue to support yourself while you breastfeed and make sure baby's needs are met? From a food standpoint, the best nutrition support comes from a balanced, whole food diet. This is where your community of support comes in. When people ask what they can do, healthy prepared meals is your answer. We want to increase your protein and hydration throughout this period too. Not only are these things critical for a recovery, but they will help you maintain your energy whilst breastfeeding. Now, if you're breastfeeding, you're supplying each baby with about 500 calories per day. Make sure you're consuming this extra to keep yourself healthy and replenished. So yes, if you have twins, then you're breastfeeding. That means you should be consuming an excess of 1,000 calories more than you were pre-baby. Supplementation during this period is really dependent on your particular experience. You should be continuing with your prenatal while you're breastfeeding. I typically recommend the Best Vitamin Prenatal Sap. You also want to consider some extra vitamin D, particularly if you're in the Canadian climate. We just don't get enough. And this is something you can supplement baby with too. Get your vitamin D tested so your healthcare provider can accurately recommend a dose for you. A probiotic may also be helpful throughout this period. If you were given any antibiotics around the labor or birth, this will help to restore that gut flora. And any sort of abdominal trauma will throw things off digestive-wise too. The other benefit of probiotics comes on passing those to baby through your breast milk. It can help with boosting immunity and preventing some atopic diseases like eczema. When you're choosing a probiotic, make sure you pick one with multiple strains and a dose between 10 and 20 billion. I love the Genestra HMF multi-strain. We may also want to consider a B complex at this time, particularly if your prenatal isn't providing you with tons of B vitamins. These will help your energy and your recovery, as well as your stress levels. The AOR Advanced B Complex is a great choice. Lastly, have your iron checked. You will have bled a lot by this point, and it's possible you were depleted throughout your pregnancy too. This is an important part of your recovery, and making sure your iron is in a good place will prevent further bleeding, dizziness, fatigue, weakness, headaches, and heart palpitations. When you supplement with iron, this can make constipation worse, so you may have to double up on some of the strategies we discussed earlier. I almost exclusively recommend the best vitamin heme iron to my patients. It is extremely well absorbed and has the least constipating effect based on what I've seen. Lastly, if you're experiencing a lot of overwhelm or stress and feel that unraveling starting to happen, you may want some adrenal support. Now, if you're breastfeeding, we still need to be super careful about introducing herbs. It's safe though to continue with your B complex and vitamin C as great basic adrenal support. Let's get into breastfeeding. The moms on TV always make it look easy. It's not. It requires learning and optimal circumstances on the part of both baby and mama in the beginning, and can be quite frustrating until you get the hang of it. If you're really struggling, consult with a lactation and breastfeeding coach to help. They can be lifesavers when you really need them the most. The benefits of breastfeeding really do make the struggle worthwhile. If this is something you can do for your baby, that is wonderful. However, if you do need to discontinue because of low supply, fatigue associated with breastfeeding, or you may have to return to work, then that's okay too. I want to quickly address some of the key concerns we come across with breastfeeding and give you some tips on how to manage these. The number one reason women stop breastfeeding is a low supply of milk. There are a number of things that can be addressed that are contributing to this. It could be you've started up birth control again, and those hormones are preventing milk producing. It could be low calorie intake, dehydration, or even antihistamines. There are also some underlying causes of low milk supply too, things like PCOS or thyroid dysfunction. So how do we encourage more milk? Oats, garlic and ginger, brewer's yeast, increase your water intake, rest, and relax. Herbs that can be helpful include fenugreek, blessed thistle, goat's rue, fennel, and moringa. There is a traditional medicinal tea called mother's milk you could try. Organica also has a ma's milk supplement with a couple of these herbs too. Okay. Next, let's talk nipple pain. The struggle is real. First, if you can improve baby's latch, this can help with your discomfort. You can also try warm compresses and breast shells. As a topical application, try coconut oil or Medi honey. Both of these are also antibacterial and safe for baby to consume. You can also try shea butter, calendula, and marshmallow. The herb, not the ones you put on your s'mores. You can also try putting some breast milk on the nipple for healing and relief too. You may also experience blocked ducts. Most of these will resolve within 48 hours. If it persists beyond 48 hours, see your doctor. But in the meantime, try rest, heat, and massage. You can massage with castor oil too. Just make sure the baby doesn't consume any of this. Lastly, let's address mastitis because there's a lot of confusion around it. This is caused by an infection. You may get a fever and flu-like symptoms and fatigue, and you'll get a painful red breast lump. If you have mastitis, you can continue to breastfeed on the affected side. You should also rest, apply heat to the area. Again, you can try the cabbage poultice, and you can also try a potato poultice to reduce pain and swelling. Vitamin C and zinc could be helpful here too, and garlic can be used to help with the infection. We want mastitis to resolve within 24 to 48 hours. As wonderful as breastfeeding is, the most important thing is that baby gets fed. So if baby isn't gaining well, or if it's causing more harm than good to the family, it's okay not to breastfeed too. There's a lot of pressure now to breastfeed as long as humanly possible, which is a great sentiment. However, it truly can't work in some cases, and you should let go of your guilt about that. Do what you can for 6 weeks and then see how things are going. Okay everyone, I hope all you new moms and future mamas to be found this video informative with some tangible tips for getting prepared for this period of your life. Again, I'm Dr. Tiffany Zugan, a naturopathic doctor and a member of the Vitamart educational team. We wish you all the best with your new little ones. And if you liked this video, don't forget to like and subscribe below for more info and life hacks.